In craniomandibular dysfunctions there are many concusses of the problem. Local causes and general causes, which affect the proper functioning of the system. In this video, we will present a chronic patient, who suffers from multiple dysfunction, who was not treated adequately for more than 10 years. In this lateral photo, we can observe how the dysfunction of the system affects the cervical spine in a remarkable way. At the buccal level, an evident lateral deviation is observed. Observing the posture, we see a thoracobrachial triangle wider on one side than the other, which could mean postural alteration linked to a real or true short leg. We can observe how the craniofacial dysfunction bilaterally affects the oculomotor system, causing bilateral hypoconvergence. At the buccal level, an evident lateral deviation is observed. In the next two slides, we observe the lack of a functional occlusion, without guides, or curves, with a prosthetic rehabilitation not made according to the rule of art. We observe the effect of defensive bruxism, which has worn out the anterior guide. In the tomography of the T.M.J. we observe the perforation of the articular disc, and the deformation of the condyle. And the posturometric tracing, we observe how when closing the mouth the postural overload increases. The mandibular posture alters, directly affects the temporomandibular joint. Increased joint pressure can perforate the joint disc and deform the mandibular condyle. Dysfunction of the craniofacial system directly affects the static posture of the body. We come to the end of the presentation. I hope it has been useful, and we look forward to seeing you in the next broadcast of our online television.